Do you have a family member or a close friend with some kind of disease? I have worked with a lady who, in her late 50s, who was diagnosed with Parkinson's disease. She loves to ride horse, but her disease has gotten worse, to where she cannot control her legs movement anymore when she rides her horse, and her legs would move without any control. But her horse would then start to go faster as it was from her leg cues asking to go faster. So my job was to figure out how to make it easier on her while riding. It was not only challenging for her, but for me as well, because I had no idea where to start. Parkinson's disease can be very, very hard on a person. Parkinson's disease is a progressive disorder of the nervous system that affects movement. As seen at Mayo Clinic, it usually starts off with barely noticeable tremor in just one hand, and then the tremor begins to move to the other hand and legs, and is much more noticeable as the disease begins to progress. Aging, as we know, has its hardships. Our organs start shutting down and start to develop signs and symptoms. Parkinson's disease is one that some older people start to develop as they age. Sadly, there is no cure, but medication slows the process down. As said earlier, many diseases can come with age, and so can Parkinson's disease. There, of course, are other causes to this disease happening to someone. According to the Parkinson's Disease Foundation, 15 to 25% of cases can be inherited through genetics. Environmental factors can also play a role in the onset of this disease. The foundation has found the disease may also result from exposure to environmental toxin or injury. Examples of this would be well water, manganese, and pesticides. A synthetic neurotoxin agent called MPTP can cause immediate and permanent Parkinson's. This is how the general population will get this disease. Signs can vary from person to person. Like I said earlier, a main sign of Parkinson's disease can be tremors in the hand. Tremors consist of shaking, usually begins in a limb, like hands and fingers. This happens when your hand is relaxed. Mayo Clinic explains another symptom of slowed movement, also known as bradykinesis. The disease over time will take over and make you start moving slow. Steps may become shorter when you walk and may be difficult to even get out of a chair. Along with it being hard to move, your posture may start to be bent in forward motion, and balance problems will start to develop. Muscle stiffness may occur in any part of the body. As the disease begins to progress, loss of automatic movements like the ability to blink and smile will start to decrease, and your speech will start to slur. There can be many signs and not always a treatment that can cure this. Parkinson's disease has no cure. The first approach of treatment is with medications to try to increase the levels of dopamine in the brain, according to Parkinson's Disease Health Center. Dopamine is a compound present in the body and acts as a neurotransmitter. There are many different kinds of drugs that are prescribed to help with symptoms, but one of the most common prescribed is levodopa, also known as L-Dopa. It is the most commonly prescribed and most effective drug for controlling with the symptoms. The drug is transported to the nerve cell in the brain that produces dopamine. It is then converted to dopamine for the nerve cells to use it as a neurotransmitter. Another way of treatment is surgery, and they are both brain surgeries. These are done less frequently due to higher risks. Alternative treatments are always another option, which includes speech therapy and physical and occupational therapy to help with the movements and other symptoms. Not everyone can take care of themselves, but during this time. When someone has Parkinson's disease, depending on how bad the progression is, they can be taken care of at home by either a significant other or someone that can come home and take care of them. Nursing home care can also be another alternative, as well as assisted living. This way, they can be made sure that they have someone watching them at all times and are able to get them the therapy and treatment they are needed. It is a fast-acting disease and can be quite serious. It is sad to watch people deteriorate so quickly from the disease, but I am happy that I was able to help someone out that could have this disease and is able to live on the dream of riding her horse.